What if doctors push these 3 mandatory tests after 70? Would you agree or think twice? Well, research shows you might want to refuse them. I am talking about heart stress testing, PSA prostate screening, and colonoscopy. The medical guidelines actually recommend against most of these for people your age, but almost nobody talks about it. You know what? I have been talking to so many friends lately who feel completely confused about this. Maybe you feel the same way. One day, someone tells you these tests are absolutely important. The next day, you hear they might do more harm than good. Here's what I want to share with you today. I have spent time looking at the real research, not scary headlines or oversimplified advice, but actual studies from medical journals. Because you deserve to know what the science really shows about these 3 tests. For each one, I will share what the current medical guidelines actually say, what benefits you might get, and what concerns you should know about. All the study links will be right there in the description below. But here is something that might surprise you. One of these tests that many people think they should avoid completely? Recent research shows it may still help certain people over 75. And another test that sounds really important, the guidelines actually suggest most people your age should skip it. So let me start with the test that might surprise you the most. Heart stress testing when you feel perfectly fine. Most assume it is always smart to check your heart, right? Well, here's what the research actually shows about stress testing when you have no symptoms. Test number 1, cardiac stress testing in asymptomatic seniors. Let me tell you what a cardiac stress test really is. Picture this. You walk into a doctor's office feeling perfectly fine. No chest pain, no shortness of breath, nothing wrong at all. But they want to put you on a treadmill and push your heart to work as hard as it possibly can. They are looking for blocked arteries before you even know there might be a problem. Now, this might sound like a smart idea at first. Who would not want to catch heart problems early, right? But here's where it gets interesting. The major medical organizations, the American College of Cardiology and the American Heart Association, actually recommend against this kind of testing for people who feel fine and have no symptoms. Why would they say that? Well, it turns out that when you test people who feel perfectly healthy, you often get results that do not really mean much. The test might show something that looks concerning, but it might not actually be a problem that needs fixing. And here's the tricky part. Once you get an abnormal result, it usually leads to more tests. So you go from feeling great and having no problems to suddenly finding yourself getting a heart catheterization. That is where they thread a tiny tube through your blood vessels to look at your heart arteries up close. And sometimes they find a small blockage that probably would never have bothered you, but now everyone feels like they need to do something about it. I want to be clear, this is not about avoiding all heart care. There are definitely times when stress testing makes perfect sense. If you have multiple risk factors like diabetes, high blood pressure, and high cholesterol all together, your doctor might want more information about your heart. Or maybe you have been sitting on the couch for years and suddenly want to start jogging every morning. In that case, checking your heart first could be really helpful. Some people need heart clearance for their jobs, like pilots or drivers of big trucks. And if you have other health conditions that put extra strain on your heart, testing might give you and your doctor useful information. But for most people who feel fine, there are often better ways to take care of your heart. Keeping your blood pressure and cholesterol in good ranges, with medication if needed. Staying active in ways that feel good to you. Paying attention to how you feel during normal activities. Before you agree to any heart test, here are some questions that might help you decide. What will we do differently based on the results? If the test shows something, what happens next? Are there other ways to check on my heart health? And most importantly, how will this test change my daily life or my treatment? Remember, you know your body better than anyone. If you are having symptoms, chest pain, unusual tiredness, or trouble breathing, that is different. But if you feel good and are just wondering if you should get tested just to be safe, well, that conversation with your doctor just got a lot more important. Test number 2, PSA testing after age 70. The PSA blood test is probably one of the most debated topics when men reach 70. PSA stands for prostate-specific antigen, and it is a simple blood draw that measures protein levels that come from your prostate gland. When those levels go up, doctors often worry about prostate cancer. But here is something interesting about this test. The United States Preventive Services Task Force, the group that reviews all the medical research to make recommendations, actually advises against routine PSA screening for men over 70. That might sound shocking if you have been getting this test every year for decades. The reason behind this recommendation comes down to some pretty eye-opening research. Studies have found that a huge number of men, we are talking about 60 to 70% of men over 70, actually have prostate cancer cells in their bodies. The surprising part? Most of these men never know it, and it never causes them any problems. They live completely normal lives and eventually pass away from other causes, never having been bothered by these cancer cells. This creates what doctors call the overdiagnosis problem. When you do a PSA test and find elevated levels, it usually leads to a prostate biopsy. That means taking small tissue samples from your prostate to look for cancer cells. If cancer is found, which happens fairly often, it puts you in a really tough spot. You now have a cancer diagnosis, but there is no way to know if this particular cancer would have ever caused you problems. The challenge is that once you have that diagnosis, the natural response is to treat it. Surgery and radiation therapy are the main options, and both can have lasting effects on your quality of life. We are talking about potential issues with bladder control and intimate relationships that might never get better. So you could end up dealing with these life-changing side effects from treating a cancer that might have never bothered you at all. That is a heavy burden to carry, especially when you felt perfectly fine before the test. Now, this does not mean PSA testing never makes sense after 70. If your father or brother had prostate cancer, especially at a young age, your risk might be different. Some men have concerning symptoms like blood in their urine or trouble urinating, and in those cases, testing could provide important information. If you are in excellent health and expect to live many more years, you might decide the information is worth having. The key is making that choice after understanding what could happen next. Many men find it helpful to shift their focus away from screening and toward paying attention to their bodies. Are you having any new symptoms? How is your overall health? What does your family history look like? These conversations with your doctor can be much more valuable than an annual blood test. When you do talk with your healthcare team about PSA testing, ask them about your personal risk based on your health and family background. Find out exactly what would happen if the test comes back elevated. Most importantly, think about your own values when it comes to medical intervention. Some men want to know everything possible about their health, while others prefer to focus on how they feel day to day. Both approaches are completely valid. Test number 3, colonoscopy screening after 75. Colonoscopy screening presents a completely different situation than the other two tests we just talked about. This procedure involves a thin, flexible camera that travels through your entire large intestine while you are under sedation. The doctor can see the inside walls of your colon and remove any small growths called polyps that might turn into cancer later. Many people over 75 actually have good reasons to consider stopping colonoscopy screening. If you have had several normal colonoscopies over the years and no family history of colon cancer, continuing might expose you to unnecessary risks without much benefit. People with serious heart disease, lung problems, or other conditions that significantly shorten life expectancy might find that the stress of bowel preparation and sedation outweighs any potential advantages. And if you have had complications from previous procedures, like severe reactions to the preparation or problems with sedation, avoiding future colonoscopies could be the safer choice. The medical experts acknowledge these situations where the risks might be higher than the benefits. Here is something that might surprise you. Recent research published in major medical journals shows that people over 75 who had colonoscopy screening had significantly lower rates of death from colon cancer compared to those who did not get screened. This challenges the idea that screening stops being helpful once you reach a certain age. The biggest factor in whether colonoscopy might help you is your screening history. If you have never had a colonoscopy before, the potential benefits are much higher than if you have been getting them regularly and they have always been normal. Colon cancer typically develops slowly from polyps over many years, so if your previous colonoscopies showed no problems, your risk of developing cancer in the near future is usually quite low. Your family history also plays a big role. If your parents or siblings had colon cancer, your risk is higher, and continued screening might be more valuable. The same goes if previous colonoscopies found polyps that needed to be removed. Now, the procedure does come with some considerations for people in their 70s and 80s. The bowel preparation, drinking special solutions to clean out your colon completely, can sometimes lead to dehydration. The sedation used during the procedure carries slightly higher risks as we age. And like any medical procedure, there is a small chance of complications. But here's what the actual numbers show. Serious complications are quite rare. The research indicates that the benefits often outweigh these risks, especially for people who have never been screened before. Some people might decide to stop screening if they have multiple serious health conditions that significantly limit their life expectancy. Others who have had several normal colonoscopies might choose to focus their energy on other aspects of their health. Both of these decisions can make perfect sense depending on your circumstances. There are also alternatives to consider. Stool-based tests that you can do at home are less invasive options, though they are not as thorough as colonoscopy. These tests look for signs of blood or cancer cells in your stool samples. When you sit down with your healthcare team to discuss this decision, think about how you compare health-wise to other people your age. Consider what you would want to happen if the procedure found something concerning. Ask about less invasive options that might work for your situation. Most importantly, be honest about your values and preferences. Some people want to do everything possible to catch problems early, while others prefer to avoid medical procedures unless absolutely necessary. Neither approach is right or wrong. They are just different ways of thinking about healthcare as we age. Your choice should feel right for your life, your health, and what matters most to you. So there you have it, the real story behind these 3 important screening decisions. Heart stress testing is rarely helpful if you feel fine. PSA screening after 70 often causes more problems than it solves. And colonoscopy? Well, that one really depends on your specific situation and health history. The most important thing I want you to remember is this. You have the right to ask questions and make choices that fit your life. Use the information we talked about today to have better conversations with your doctor. Remember, all those study links are waiting for you in the description below. Your health decisions should always feel right for you. If this helped you, please like and share with friends who might benefit. I would love to hear your thoughts in the comments and subscribe for more evidence-based health information. Disclaimer: this video is for educational purposes only and is not intended as medical advice. Always consult with your healthcare provider before making any decisions about your medical care or treatment.